Hello, everyone. This is Dr. Chris Link from the Integrative Medicine Clinic, and I'm in my backyard enjoying some wonderful weather this fall. Great sunshine, green space, and it makes me think about vitamin D. Vitamin D is such an important vitamin for us. It helps us with our brain, our heart, our immune system, and our bones, as you all know. I wanted to let you know that vitamin D is mostly made through our skin. It's really hard to get enough in our food. I'll come back to that in a minute. But it's really hard to make enough vitamin D from the sun after about September 20th because the sun goes lower in the sky and the energy from the sun that we can absorb in our skin to make vitamin D is less. So after about September 20th, that is today, it's really hard to make enough vitamin D from sunshine. We also know it's really hard to get enough vitamin D to really keep us healthy from our food. There's a few foods like salmon and sardines that do have a pretty good amount of vitamin D. And there are other foods that have small amounts of it, things like eggs and egg yolks, grass-fed beef, fortified milks. So it's really hard to get enough vitamin D from our food, and it's pretty much impossible to make enough vitamin D from the sun when you live in Missouri after about September 20th. So it's important to take a vitamin D supplement. And along with this is some very, very important information that was recently published in two journals about vitamin D levels and the use of vitamin D to enhance our immune system in this time of COVID-19. Let me tell you about these. The first study was done at the University of Chicago, and they followed 489 people that had had a vitamin D level over the last year. And they found out that people that had low vitamin D levels, less than 20, that the likelihood of getting a COVID infection was 1.77 times more, almost 2 times more than people that had normal vitamin D levels. This is really important. Really important to have the right vitamin D level because vitamin D supports our immunity in a very big way and keeps us ready for a virus, makes it less likely we're going to get it, as based on this study. And it also helps us modulate our immune system so we don't have too aggressive of an immune response with cytokines and other sorts of things that can create more tissue damage and poorer outcomes with COVID-19. Now, the second study I think is just as important. Here they followed 76 people that were admitted to the hospital with COVID-19. So they were sick enough from COVID-19 that they needed hospitalization and oxygen, etc. They found that the group that they gave higher dose vitamin D, they actually gave them 20,000 units day 1 of their hospitalization and then 10,000 units day 2 through 10. And they found that those people, those 50 people out of 76 that were given this higher dose vitamin D, that only one of those people ended up in the intensive care unit, only one of those patients. None of them died. Now, there were 26 people in the other group that did not receive the vitamin D. 13 of these people ended up in the intensive care unit and 2 people died. This is a preliminary study, but it's very important because we know the mechanisms behind vitamin D. It helps us modulate and have an appropriate immune response. We also know that vitamin D is incredibly safe, that even at these higher levels, and I don't recommend this generally at home, but 20,000 units day 1 and then 10,000 units for 10 days, there's no serious consequence to that. So vitamin D clearly makes a difference. One of the things we've learned recently that vitamin D does is it improves the epithelial cells and barrier in our respiratory tract, our nose, our throat, and in our lungs. It makes the barrier more impervious to the infection. It also readies the immune system, and it also decreases the amount of excessive immune response that can get people in trouble as they move through this infection. Vitamin D is clearly really very important. Now, let me just say real quick about the other things that are important in regards to protecting us during this time of COVID-19. The data clearly shows now that masks help people around you and help you have a less severe, possibly no infection at all. I'm a big mask advocate. I think the data from many, many studies now indicate that these indeed work, so I recommend those. But more importantly than that is to take care of yourself. That is to get good nutrition, colorful, nutrient-dense foods, to get modest exercise, to take your vitamin D, and consider some other supplements. Zinc, about 20 milligrams a day, supports the immune system and makes it less likely that the virus can get deep into our tissues. Omega-3s, 1 or 2 daily, also help provide a robust immune response without having an excessive immune response. And then vitamin C at about 1,500 milligrams daily also is shown to decrease respiratory viruses. So all of these are important, these supplements, but most important, great nutrition, modest exercise, great sleep. And if there's one supplement that's most important, it's vitamin D. And for most people, it's 2,000 to 4,000 international units daily. You can get your vitamin D level checked. You certainly want it over about 20. And right now, we know that 40% of Americans are low in vitamin D. If you've got a concern that you're low, let us know. We'll get your level tested, and then we can give you additional vitamin D supplementation to bring that level up to a safer area. I want to give you a little bit of news from the Integrative Medicine Clinic at the end here. We moved right down the street. We're just about a half a block away. We're now at 1002 Diamond Ridge, Suite 1200. And at the Integrative Medicine Clinic, we'd like to bring information to our community through videos like this to help improve health. And in the clinic, one patient at a time, partnering with patients to improve their health. We wish you the very best of health.